Hello, everyone, and welcome to another episode of Insights with MindAid Therapist. I'm Manasi, and I'm a clinical psychologist. And as April was Autism and Occupational Therapy Awareness Month, that's our topic for today's discussion. And I have a very special guest joining us today. Her name is Apoorva Deshpande, and she is an occupational therapist. And currently, she is working in pediatrics. So, thank you so much, Apoorva, for joining us today.
Thank
How are you
you. Thanks for
doing?
the introduction. I'm good. How are you?
I'm doing well. So
Mhm.
I think just to give viewers a little bit of context, so me and Apoorva, both of us, we met when we were back in Nashik. So both of us come from the same city, and we happened to work in the same clinic for some time, and definitely enjoyed the conversations that we had back then and discussing cases. So yeah, it's really nice to talk to you again and connect with you.
Same here.
Um, Right. So I think so I do have, specific questions that maybe you can answer about occupational therapy and autism. But before that, I'll maybe tell our viewers a little bit about what is autism. So it's a neurodevelopmental disorder. It's also called as autism spectrum disorder, as there are many different subtypes. And there are basically two main categories of symptoms that are used to diagnose this condition. So, first one is communication difficulty. So, a child with autism may have a difficulty in initiating conversations with others, or sharing their emotions, or understanding other people's emotions. And they might also have a certain degree of delay in their language development. And the second category of symptoms is selective interests and repetitive behaviors. So these children might have very, specific and selective interests, and they might also repeat certain behaviors like certain motor movements, or like something like hand flapping. Or they might also have like an excessive preference for routines, and they might not react very well to change. And all these symptoms again in turn lead to a lot of difficulties in their like independent living. And they also have sensory sensitivities as well. So yeah, this is the general idea about what autism looks like. So coming to you, Apoorva, first of all, you can of course definitely tell us more and add to what I have talked about. But yeah, I would first like to know how you developed interest in this field and how you chose this as your profession. So could you tell us a little bit more about that?
Yeah, sure. So I started my bachelor's in occupational therapy back in 2011. I knew I wanted to do something in medical, but I wasn't sure what area or like what field specifically I'm planning to go. And I did my research. Got into occupational therapy. I wasn't fully aware of that, of how much the field has to offer back then. But after I completed my bachelor's, I knew that there is so much you can do in this field, from like, like catering the population from geriatrics to pediatrics to, like various diagnoses from mental health to orthopedic surgery. So that just kind of gave me a very wide perspective of how much this profession has to offer. And when I started working in pediatrics, and I understood how interesting it is to use tools like sensory integration and neurodevelopmental techniques to work on kids. And I realized really soon how rewarding it is, and how driven I am to the process of therapy. And that's how I kind of developed my interest, and I was keen towards like working towards pediatric population. That's when I decided to then further do my master's. So I came here in California, I did my master's, and I continued working to practice in pediatrics since then.
Wow, I can definitely relate to the rewarding part of the profession. It's definitely that. Right. So it's really interesting, and I'm sure like not many people know about this field. So that's one of the reasons why I think we thought of having this discussion and this conversation. So right. So that brings me to the next question. That as I just described the different symptoms of autism, what are some of the difficulties that a child with autism may face, in their day-to-day life?
Yeah. Yeah, that's a good question. Since for the most part, I'm spending my work hours with kids with special needs, and especially with autism, I have seen, how their day-to-day life looks like. So, like everyday challenges for kids with autism is mainly, in the areas of like understanding their sensory integration, so understanding their senses and how they are in turn able to implement that into their routine, or how to work on their senses and for them to be able to participate fully in the occupations. um, um, some other challenges are skills like fine motor skills, gross motor skills, feeding, dressing, understanding concepts. So overall, I think since the diagnosis is neurodevelopmental, it really does affect their developmental functions throughout, what they're occupied with. And our main focus is to kind of work towards helping them to be able to participate in their occupations.
Mm-hmm. So it may of course differ from like child to child, right? Like what kind of challenges they may face.
Mhm.
But yeah, like definitely all these symptoms, as you've explained, they do affect their daily lives, and there then the role of occupational therapy comes in, right? So first of all, I think as many people might not be aware of, what is the exact application or what an occupational therapist does. So could you tell us about that, like what is occupational therapy and how it can be used, with different, not just with autism, but with different neurodevelopmental or other conditions?
Other conditions. Yeah, sure. So, occupational therapy is overall, like focuses on promoting well-being and enabling people to be able to engage in everyday occupations. Most of the times it's misunderstood that occupations is something that you do for a living, for you to earn money, but it's not necessarily that. It's more so, what you're occupied with throughout, your everyday routines. And it can be brushing your teeth or taking a walk and taking a shower. So, all these skills. And then if you have any mental health condition, or if you have any neurodevelopmental condition or any other injuries because of which you are not able to perform these everyday routine activities, that's where occupational therapy comes into play, where we use these occupations to also treat and also modify your environment so that you are able to completely and at your best of the abilities, you are able to perform these activities or meaningful occupations that you want to engage in. So that's overall what occupational therapy focuses on. And then again, it really differs a lot, in terms of like what area you're trying to target. So since we are especially talking about like autism today, um, kids with autism are, I mean, a pediatric population at the end, are mostly occupied with play and learning and self-care routines like self-hygiene, sleeping, eating, dressing, all that. So our main focus of area, like occupational therapy's main domains are physical skills, adaptive skills, cognitive skills, and sensory integration when it comes to pediatric population.
So basically, everything that a child requires in their
Mhm.
day-to-day life, what they need to do, or like yeah, how they can do it, especially the kids who are, with special needs.
Mhm.
So it definitely then covers a lot of like a broad area
Mhm.
of application, right?
Yeah.
Um, Right. So, do you think then occupational therapy is something that is like essential or like highly important for someone with autism, and like how that can help a child with autism?
Yeah. Say for example, you have a child who's say 4 or 5 year old who is expected to do who is expected to button his shirt by himself, who is expected to feed himself and brush his teeth by himself, and all these things that are age appropriate that he's supposed to do in that age. But because of his autism and because of the underlying deficits, he's not able to do so. Then we dig deeper into what are the deficits. So for example, the underlying deficits are fine motor skills or sequencing or attention, that he's not able to pay enough attention to understand the sequence of certain tasks. So we work on all those components, the base of the components and the skill sets that you need to perform these occupations. So when we work on that, and then overall, we help towards, or we walk that child towards being functionally independent, or for him to be able to do those skills by himself. So that, with that being said, there is also like a huge role in terms of like sensory integration, because kids with autism have some kind of sensory sensitivities, or sometimes they are seekers, sometimes they're hyper or hypo. Meaning sometimes there are certain senses that they are very sensitive to, so they get or we call it hypersensitive. And then there are certain senses that no matter how much you provide them, there is still that lack of registration, which is hyposensitivity, meaning they need more of that. So it's kind of fall into like, you'll see like that imbalance of hypersensory and hyposensory. And our goal again kind of work towards kind of creating that balance in the senses, so that they are able to integrate all those senses in a optimal way, and that should not interfere with their participation. So working on that, working on that barrier for them to feel good, and then move forward with what they are expected to do, if that makes sense.
Yeah, that does make sense, and that helps us understand what is the exact role of occupational therapy and how it can help. Like, yeah, of course, when you mention sensory integration, and if like a kid is, let's say, like hyposensitive, or like let's say for hearing, so that's where maybe that's how I can relate to. So if a child is like self-absorbed and you call the child several times but doesn't seem to respond, so is that where the sensory integration part comes in, and like that's where we can intervene?
Yeah. So and again, like as you mentioned, it's important to know what senses are, right? Like it's important to know what are the senses that we primarily have, and how it affects our functioning. So the senses are vision, taste, smell, hearing, but it's also important to understand two more senses, which is the sense of movement. So understanding how fast you're moving or how slow, the rhythm of your body, and how you're moving in space. And then there is other sense called proprioception, meaning your understanding of so your overall body awareness and understanding of like how much force and pressure you should apply to do certain things. So these are also, we call like brain senses, or like deeper level senses that does, and you will see deficits in these domains, because of which you'll see a child moving around in the room and moving around in circles or spinning himself, because he's we call it into a movement seeking behavior. So he wants movement more than others for him to be able to function, for him to be able to register that sense. Or you'll see a child writing really hard and applying a lot of pressure when he's writing. That is a sense of proprioception, meaning he needs a lot of force and pressure for him to be able to function, or for him to be able to do certain tasks. So then we understand and take into consideration how he's behaving in his environment, and then kind of, just underlining what's happening. So like, is he sensitive, or is he seeking, or is he having a hard time registering these senses? So in what quadrant is he falling, and then just working towards that quadrant. and for him to be, then able to understand what's going on, what's going on with his sense. And that's how he kind of helps him to participate in task what he's supposed to.
Okay, so thanks for explaining that, because I think what we see as, these are called problematic behaviors, wherein we see seeking behaviors or like any kind of repetitive movements. So I think they are serving some kind of function, right? Like where the child is, trying to manage. Or like basically it has a reason and it has a purpose. But these are usually just seen as problematic behaviors and the child is blamed. So of course, I think they do need to understand the, the science behind it or the mechanism behind it. So that definitely helps. So as I understand, like every case or every child is different, so they may have different needs. But overall, how many sessions do you think, are required generally for sensory integration or for OT in general?
So overall, I would say it kind of depends on the age of the child and, where he's at, what's the baseline that we have. So you have someone who is younger and who is diagnosed early, has a whole development ahead of him. And as the whole diagnosis is neurodevelopmental, meaning overall, as he's developing throughout his age, he'll have certain challenges that he needs to achieve. And for that, he would kind of need that helping hand and support throughout his developmental span. So it depends on that, and sometimes if you have someone, who has minimal sensory concerns and, at a functional level that he's almost age appropriate, then in that situations, you need minimum help. And that help would be like consultations and helping family and more of like parent education and stuff like that. But if you have someone that does have severe or like significant deficits because of which he's not able to, achieve that age appropriate functions, then in that situations, the sessions usually go from like just having sessions every week for like, throughout his developmental course. That way, it's like an ongoing process, and we make sure we are working on the skill and we are maintaining the skills, and there's this consistency and consistency of the therapy for the child to have better results.
Okay. So could you give like an example of someone you've like seen, or like anything that you would like to share as an example?
Yeah, so mostly right now, the clinic I'm working at, mostly I have kids with autism. So overall, to explain autism from an example, I would say it's very interesting how they function, in the sense that it's important for us to understand and differentiate them from what they are going through versus at the end they are kids, and they have their needs, and at the end they have their emotions and feelings. It's just that they have a hard time to explain, and for the most part I have kids who are non-verbal, so then it just becomes an additional challenge for you to understand what they really want. And that's where like just the overall understanding of sensory comes in play, where you look at how they're responding to certain environmental stimulus. So if a child enters in a bright room and right away you'll see a meltdown or a tantrum, you just kind of have to understand, oh, maybe he's bothered by lights, or maybe he's bothered by too much noise in the room. So then just kind of reading him first before reacting. If a child is having a tantrum and then you say, for example, as a parent, you're getting stressed because he's having a tantrum, scolding him or just saying, oh, stop crying, doesn't really make sense here. You really have to kind of take a step back and understand, why is he crying in the first place? Is it because noise, or is something what he's wearing is bothering him? It can be texture of clothes, so it can be anything, like even sensory wise, that can be bothering him, and just kind of working towards how comfortable you can make him first in the environment. And that's how you learn, and that's how you read a child with autism, is you slow down yourself and you understand him. Try to understand him as much as possible every time, so that then you are in a better position to offer help. And that's something I have kind of experienced through like through the practice, is it's important to read the situation. You cannot go planned in front of the child with autism. You need to understand them first before you have a plan.
Right, right.
Yeah. Mm-hmm.
I think so that's where like your empathy comes in and
Mm-hmm.
your ability as a therapist also, where I think we stress on this a lot as well, like rather than jumping to a conclusion or like judging, it's really, so what you said makes a lot of sense, like just taking a step back and looking how every behavior has a function. So if the child is crying, there definitely is a reason. So
Yeah.
like rather than jumping to a conclusion or like scolding or
Mm-hmm.
reacting, right?
Mm-hmm.
So right, that's
Yeah.
that's really important. So as we were talking about sensory integration, something that maybe I would like to know more about is, maybe could you tell us or maybe give an example of like what a sensory situation might look like for a child, and then how we can, or how an occupational therapist might intervene there.
Mm-hmm. Yeah. So when it comes to sensory, there are two ways, in the sense that one is to, like work towards what's the deficit and try to intervene the deficit in itself. And second would be making modifications. That way the environmental modifications are suitable for your sensory needs. So it goes both ways, with modifying the environment, but also working towards desensitizing, and for you to be able to process the senses in a better way. A simple example would be, I have a 17-year-old that I'm seeing, and she's on spectrum, and she is bothered by noises. And to a point where, in a typical child or in a typical person, if you're trying to focus on something, for example, you're reading a book, and somebody is trying to vacuum um, in the background, if you're really focused into reading, and if you're enjoying what you're doing, you're able to shut down the background noise for you to be able to focus. But what happens in autism is, if you're really sensitive to those noises, it doesn't really is a background noise. It's really at the similar level of the noise that you have. So for this girl that I'm seeing, she said she has a very hard time having a conversation in a cafe, because she's talking to the friends, and what her friend is saying, and like the background noise of like someone is talking at the other table, or the waiter is asking a question to someone else, or somebody of the kitchen noises, so all these noises are kind of gets together and becomes very overwhelming for her, and then there's this sensory overload where she just cannot have a conversation. um so in this situation, there are two ways to help her. One is for her to understand that this is what she's facing. She has sensory sensitivity towards noises, because of which she's having a hard time kind of balancing the background noise versus what's important noise that she needs to focus on. So environmental modifications would be going in a place where there is less distractions, or going in a cafe, or trying to find a corner spot where there is less noise, or trying to sit away from the kitchen where there is less noise. So just kind of making that environment, or also like trying to wear noise cancellation headphones. So these are some of the modifications. But you get what the way to intervene that problem would be just for her to be able to desensitize noise, and just practice more of like trying to work in a busy environment, or trying to have um, a regular busy environment noise on at home while she's trying to focus, and just kind of working towards desensitizing herself, and for her to be able to perform better in a noisy environment. So this is just a simple example of noise, but it kind of tells us a lot about how things are felt, or how things are perceived by us versus how things are perceived by kids with autism, and how you can help them go through it for them to be able to perform.
Right. No, that really helps us to understand like how it actually feels, like how these symptoms actually feel like for somebody, and like that can be very distressing just to go through. And right, so then it works both ways. So you either like modify the environment wherever you can, and also improve your tolerance or the child's
Yeah.
adaptive.
Yeah.
Right.
Mm-hmm. Mm-hmm.
Okay. Right. So I think I want to talk a little bit about the status of occupational therapy in India, like where it stands, or like how accessible it is, or how much awareness there is. So what do you think about that? And if you could, if you could, tell us more about that.
Yeah, I know it's, like occupational therapy is a relatively new field in medicine overall, and I know it's in the process of gaining, in the process of creating that awareness. Not many people know about occupational therapy, but lately I've seen, a shift from like not fully aware of to people starting to know a little bit about occupational therapy, given the rise in the given the rise in the cases, and also
Yeah.
like today's needs of being independent has made people approach therapies like this, and overall just having more awareness about their health has made people go towards more conservative approaches, right? So it's not fully bad. I know there is a lot of work to be done, especially in the cities. You do have access to occupational therapy. People are willing to pay out of pocket for you, and just kind of get that therapy or get that consultation. It's relatively difficult to have access in the rural areas. But thankfully, after pandemic, again, I have kind of seen that changes overall with like people having more access through virtual sessions, and even someone like, for example, someone like me who is sitting in California but is able to provide services for people in India. So there's this lot of like awareness for the use of laptops and use of social media has really made a difference in people having that access to services virtually. um, I would say in terms of awareness, it's important and crucial for occupational therapy to be covered by insurance in India. I think that's a huge area that
Yeah.
we need to achieve, because it's out of pocket. People cannot always afford to pay for services, and then it becomes this um, not so consistent. So people are not consistently following therapies because they cannot afford to keep paying you after a certain point, and they just give up. So it will be a next step, I would say, for the insurances India to start covering occupational therapy.
Right. So I think, as you said, I agree that the picture is looking a little more hopeful now, and especially with the pandemic, people have become more aware of, mental health, and like we definitely see more awareness day by day.
Mhm.
So in India, I've noticed that people generally tend to lean towards, a medication for any issues that they are facing, and that is the general approach. So they usually, go towards that, and then comes other
Mhm.
approaches like therapies. But
Mhm.
whereas we have seen as professionals that medicine is just one part, and usually a multimodal or like a more integrative, holistic approach works a
Mhm.
lot better and
Mhm.
gets like a lot more improvement, and that too like a little faster as well,
Right.
um, generally speaking.
Uh-huh.
So like how would you like to weigh in on that, in terms of
Mhm.
like how these approaches can be much more helpful rather than just relying on medication?
Yeah, yeah, that's a really good questions, and I agree with you. You know how people kind of tend to go towards medicine first, and it's like a quick fix is
Yeah.
what it is looked at, where you go to a doctor, you get the medicine, take the pill, and you're done. But it is important to understand that if you are working towards a neurodevelopmental problem, it's a skill that you're working on, right? And when you're working on a certain skill, it's important for you to practice that skill for you to be able to perform in a better way. So
Absolutely.
because we are trying to target all these skills, and for that child to be able to learn all the skills like writing and reading, and for him to be able to do maths or go out and play sports, so it can be anything that you might be working on. And that's why it's very crucial at this especially in this situation, for you to kind of have those therapies where you have trained professions who know how to train you for um, who knows how to identify the right problem, and then for you to be able to do activities that kind of caters to that problem, and then for you to be able to achieve functional independence. So that's how it becomes very crucial. And sometimes, medicine doesn't, sometimes it's, as you said, it's a multi-modal approach, and we have to understand what area we are focusing on, and to understand what kind of treatment we need. So if you have like say if you have symptoms that are like really hyper and going beyond your control, or if you have a child that has extreme behaviors that are beyond the scope of therapy, that's when your therapist will also let you know that I think you also need to see a doctor, because we might need to take help of certain kind of medications, and doesn't necessarily mean like strong medications, but even simple medications like a stimulant, like you give a stimulant for an ADHD kid, for example. So just having use of small medications, or simple fix that will help you, that way the child is in a better position to do therapy. And that's where and then you have that child who is capable of doing those therapies. So, and again, like sometimes it's, it's a physical barrier. So you might need to refer this patient to a physical therapy, or if a speech problem goes to speech therapy. So then you kind of need to understand what area you're trying to focus on. And that's how you need to like go to different therapies and go to those skilled experts for you to give you the right advice in that area.
So in your experience, then you've seen a child like that has initially some difficulties, and then with OT or with other integrative approach, like have you seen that happening, or like what was your experience like working with them, with these kids?
So, for example, I let's give you an example where you get a 3-year-old, maybe who's coming for an occupational therapy evaluation. So I'm trying to kind of walk you through the process. So a 3-year-old coming for an occupational therapy evaluation, you assess him for the first time, right? And then you assess the areas of difficulties and the deficits that he have that you need to work on. And also establishing at what age level he's functioning at. So he's 3-year-old, but maybe he's functioning at a 1.5-year-old. Maybe he's 1.5-year-old late than what he's expected to. So you have that baseline, right? So then you kind of establish that, so you know what challenges you need to present to this child. Because if you would expect a 3-year-old to draw a circle, but he's not at that age level yet. So he's 3-year-old, but he's functioning at a 1.5-year-old. So maybe he's still learning to hold the pencil, So then trying to make an environment where he learns how to then able to sit. Maybe, he's not even ready to hold the pencil. His main problem is because he's not able to sit at the table, like because he's so hyper or, movement seeking. So he's mainly moving around the room and not trying to able to sit at the table. So then we work on first integrating those senses and integrating that body awareness. So we engage that child in activities like swing and bouncing and jumping and exercises and just making it all fun and play. But through all those activities, what's happening is that he's getting that movement needs that his body is wanting for. And once he gets that, and once he's able to integrate that sense of movement, then slowly he's presenting you the ability to sit at the table for 1 minute, 2 minutes, 3 minutes. So that's how you see that improvement of, oh, that's great. Now with this sensory integration activities, this child is now able to sit at the table for me. Then when you have that child sitting at the table, you need to work on, joint attention, like just for him to be able to focus on what you're asking him to do. So giving him a lot of fun activities at the table, so he works towards, attention skills and concentration skills. So these are like the basic precursor skills. So we work on all those skills for him to be finally able to hold the pencil for you, and then finally draw for you, and then finally learn how to do a circle. Even if it's a simple task of draw a circle, there is so much process behind it. And then when you work on this child on all those, all those underlying deficits first, and then work towards like the functional goal that you have, which is drawing a circle, for example. So then you work towards that, and then finally he's able to achieve that, and that's how that one skill is achieved, and that's how so many other skills that you try to aim for are achieved. So this is how you see, and you'll see a huge progress. You'll see a huge progress in kids from where they start and where they are at 6 months after. Is a huge change. You know, you'll always see a jump of like a few months to years
Mhm.
of development in that child. And when you do a progress note or like a reassessment in the 6 months, you will see that the child was functioning at 1.5 year old, and now he's functioning at like 2.5 years. So he has jumped on a lot of his skills. Again, it's
Wow.
just a relative example. You'll see someone moving from 1.5 to like 3 to age appropriate, but you also see someone from 1.5 to maybe 3 months forward. So a slow
Mhm.
gradual process. So it's not that I'm giving you unrealistic expectations, and again, it goes from child to child, but there is always a progress forward.
Right. So basically, then really, assessing where the child is at and then starting from there,
Mhm,
and then moving forward with baby steps.
mhm,
And
mhm,
right. So that's wonderful. But to be able to see, that graph going up for
mhm,
any child.
mhm,
So I think more and more people definitely should know about this, because we, as a community, also, we need that awareness, because just having that one-sided approach here might not help, but actually, even with kids with autism, along with occupational therapy, there are so many other things also, like applied behavior analysis, behavior
mhm,
therapy. All those things
mhm,
together
mhm.
can bring so much of an improvement and progress. So thank you so much for sharing that and making it so easily understandable.
Of
Um,
course.
Anything that you would like to, say to people in general, or to professionals who are working in these fields?
Mhm. Yeah, so my focus, I know we are talking about autism awareness, and I think first step is awareness. And it doesn't necessarily start with creating an awareness in a macro level, meaning towards like the larger part of the society. It's crucial at this point to just kind of start working from like that self awareness, how much you know and how much knowledge you have, or if you know someone that is on the spectrum, and you haven't really talked to that family or understood what they are really going from, so just being curious and asking empathetic and empathetic questions, and just being kind enough to get to know them, right? Instead of just concluding that he's on a disability, but then what kind of disability, how does it affect him, and how can you help him, you know so just starting on that personal level, I feel like it's very important, and that's the good way for you to be able to create awareness, because then once you are aware, you change your behaviors, and then someone else look at you, and that's how they model the right behavior. So you then become that right person to model the behavior for someone else who doesn't know, and that's how you start the chain of creating awareness. um,
Right.
so just working on awareness, I feel, is important. And when you talk about occupational therapy, in terms of like for the viewers who are in the healthcare profession, for everybody just to understand, and it also applies to obviously everyone. Even for me, I should know like what's a role of a clinical psychologist, or what's the role of a speech therapist or applied behavior therapist. So just and having a deeper understanding of what roles everyone is playing in this process of working towards a child with autism. That way, once you kind of know that, you have that collaborative approach towards the child, and you don't necessarily have the burden on yourself, because you know at the end, everyone has their own expertise, and you can easily redirect that one particular problem for that expert. um, so not only you create that holistic interactive approach towards that child, but also the family gets the right help that they need. So just kind of creating that awareness, even interdisciplinary, that everybody kind of knows, like who plays what role, and for being able to redirect kids then. I think that's how I feel like we need to kind of move towards in those directions. And always have that attitude of teamwork. And I think that's what is important in especially in a diagnosis like autism spectrum, where you have not one problem, but you will have a diverse range of problems, and not one person can take the lead to solve all the problems. So it's the parents, the family, caregiver, and all other disciplinary people who are involved.
Right. I couldn't agree more. Definitely an integrative and holistic approach is the most effective one.
Mm-hmm.
Um, so I guess that brings us to the end of today's conversation. If anyone has any questions or any thoughts that they would like to share, definitely drop them in the comments. Or if you would like to know how you can reach Apoorva, you can definitely DM us, and we will let you know how you can go about it. So thank you so much again, Apoorva, for joining us and sharing your knowledge and answering all my questions. And I definitely hope to connect with you again soon in the future.
Thank you so much. Thank you for giving me this opportunity to speak today. I know it's important for us to keep spreading the awareness on our levels, and how much we can, so that we further create a difference in the community and spreading awareness. So thank you for taking this initiative and trying to host this interview. And you had wonderful questions, and I think the viewers are able to gain some knowledge from what we have discussed today. And then if the viewers have any more questions, they can always feel free to contact me.
Definitely. And I feel like the more conversations we have, the more awareness there is. And then in turn, the goal is that people should have access and knowledge of these services, because the earlier we intervene, the more improvement or the better it is for the child, right? So yeah, that's right. So thank you so much again for joining us. And thank you everyone who took out the time to watch this video. And I'll see you in the next episode. Bye.
Bye.